Here at FIBCEM, we want to optimise patient fracture healing outcomes whilst also keeping safety our top priority.
Conventional treatments for femoral fractures include titanium rods and TENS nails, which are inserted into the intermedullary cavity. Although extensively used, this treatment is highly invasive and non-biocompatible. To overcome these problems, there has been extensive research into the use of bioresorbable bone cements to support fractures. Bone cements offer advantages over traditional metallic bone scaffolds, including less stress shielding and less risk of bioproducts building up. However, resorbable fixation solutions for long bone fractures have not been widely accepted by surgeons due to their weak mechanical properties and inability to bear load.
Our solution is a patient-specific mix of CPC, reinforced with PGA fibres, acting as a bone substitute. When complemented with PGA fibres, our research has shown that the biomaterial and biomechanical properties of CPC are desirably enhanced. The fibre reinforcement increases the toughness and fracture resistance of the bone cements, mimicking the mechanical requirements for the femoral bone during the first 3 to 4 weeks. As the fibre reabsorbs, a porous structure is formed in the bone cement, encouraging new bone growth and cement resorption. After 8 to 10 weeks, the solution is fully reabsorbed and the fracture heals.
Considering current treatments and drawbacks, our biomechanical requirements are: our device must be biocompatible, controllably biodegradable, and also produce non-toxic bioproducts whilst also being osteoconductive. It must be load-bearing, meaning mechanical properties of fixation. It must also be able to withstand kinetic movements of the femur bone. And lastly, the risks associated with biocompatibility, toxic degradation byproducts, and also inability to meet the mechanical requirements must be mitigated as safe. It's like driving with your seatbelt on. The safety requirements of our medical device are of the utmost importance. Our requirements include surgical implantation and injectability. It must be of therapeutic value whilst meeting current regulatory and market standards. And lastly, the design must also minimise the risks of surgical complications such as bone cement implantation syndrome.
Hi, as our solution is designed to fix fractures while they heal, it is essential to verify and validate the mechanical properties of the materials used. Initial finite element analysis will allow us to investigate the properties of the fibres in the scaffold and will allow us to find the ideal CPC composition for a range of patients. After this analysis, biomechanical benchtop experiments will be performed. We also need to confirm the biocompatibility of the graft. Initially, in vitro studies are necessary to determine the cell attachment and proliferation, followed by preclinical animal studies. Clinical testing to verify and validate safety and therapeutic performance in humans utilizing relevant ISO standards and quality assurance is also a requirement to ensure safety and efficacy of this novel device.
With adequate verification and validation of our design solution, we are confident that a safe and effective biodegradable reinforced cement will revolutionise fracture treatment as we know it. From all of us at FIBCEM, we thank you.